Today is November 6th, 2020, and the topic I want to cover today is urine tox screen. And this was really pertinent to me recently because I saw a patient that was here for his normal med refill for Norco, and we had recently done a urine tox screen a few weeks back, and I had noticed that it showed a positive for something called oxazepam, which is a benzodiazepine, which he is not prescribed. And I even pulled up the Cure's website, and it was negative that he wasn't being prescribed that. So immediately I felt a little bit uneasy when I first saw that result. And so on the day when he came in, I kind of went in and just was friendly to him, as I try to be with all my patients, and just I've known him for years. And so I just said, hey, how's it going? And we went over some blood work, and he seemed fine, and everything seemed normal. And then I just approached the topic of the urine tox screen, and I just asked him, hey, do you take any other medications that besides what we prescribe, or have you borrowed anybody's medications, or have you been any other new changes in your medications? And he thought about it for a little bit. He says, no, I don't think so. I don't take anything else. I mean, I was in the hospital and I was given some Valium and something else to help me sleep. And I said, oh, interesting. Do you remember the name of it? He said, no, I don't. And I asked him, was it something like oxazepam? He says, yeah, I don't know. And so he left, and I just had told him, hey, the next time we're gonna have to redo the urine tox screen because this abnormal finding came out. And he said, okay, sure. And so he left, and it suddenly dawned on me that Valium has a really long half-life, and it's up to 60 hours. And so I was like, I just wonder, since it's also a benzo. So I went to check it up, and sure enough, guess what? One of the metabolites of Valium is oxazepam. And so his urine tox screen and his hospitalization were, I think, less than 7 days apart. And so with the long half-life of Valium, I just thought, it's not out of the realm of possibility that this is most likely what caused the positive result. And so I'm glad I checked that up, because the lesson was, if I had just gone on in guns blazing, accusing him, I would have lost a precious client relationship that I've had with this guy for years and mistakenly accused him. And, so oftentimes, sure, there are patients that totally abuse and lie to clinicians. But to me, what's worse than missing someone that is lying and that's abusing and not taking their drugs is mistakenly accusing someone that's really innocent and just going in and accusing them wrongly. And to me, that's a shame. So I think this was a good lesson learned, and it reminds me of a patient I think I must have mistakenly discharged a few years back, and I just still have regret over that, because I feel like I probably didn't give him the benefit of the doubt, even though we did follow office procedure. And just one more story is another patient similarly about a few months back, where she showed up positive not once but twice for amphetamines. And we had asked her, are you taking anything that you're not prescribed? And she said no. And we looked at all her medications, and we looked at the Cure's website, and she wasn't given any amphetamines. And I just asked her and probed a little bit more. I said, there's nothing over the counter, anything like that? And she thought for a little bit. She said, well, I mean, I do have a chronic cough. I take cough medicine a lot. And I said, I wonder what kind of cough medicine, what's in it? And so I probed a little bit more, and it turns out it had some decongestants in there. And I looked it up, and sure enough, a lot of the pseudoephedrins and some other decongestants can give a false positive on amphetamines. So I thought, So I just asked her, hey, next time, don't take any cough medicine before you come here. And so we want to make sure there's no interfering substances. So she agreed to that, and we did a urine tox screen, and this time it came back negative. So I believe that's what caused the false positive, and there's data in the literature that shows that indeed decongestants can cause false positives with showing up amphetamines in the urine when it's really not amphetamines. So the lesson I think I want to get across is, number one, give patients the benefit of the doubt because you don't want to wrongly accuse someone. And number two is to continue to know your metabolites, to know the metabolites of the different drugs and what can cause false positives. Because urine tox screening is a valuable tool, but it can also be cause harm to your relationship if you don't understand all the ins and outs and what can cause things to show up positive and cause mistaken positives. So anyways, hope that was helpful, and I want to just share that clip to share that tip today. So thank you for listening.